Good morning. Happy long weekend. There are three things that we can explore to help burnout. Last week, we went over one of them, and over the next 2 weeks, we're going to go over the other two. Or this week and the next week, we're going to go over the next ones. Today, we're going to explore the physical, and I think you'll be surprised as to the perspective that we're going to go through. We'll talk about the environment as we talked about the environment last week, the physical this week, and then the internal next week, and we'll describe that a little bit better in our model that we also had a look at before. So welcome to Mental Fortress Mondays. I am Cheryl Carthouse. I'm a naturopathic doctor and currently not practicing. Our mission here at Mental Fortress Mondays is to provide a space that we can understand the who, what, where, when, why, how of mindfulness and all of the other aspects of building mental resilience to stress and helping with the burnout, especially that we might be experiencing now while everyone is still locked indoors, even though there are some changes that are taking place here as we get to explore forests and parks, at least in Nova Scotia. As we navigate some of these extreme changes, it's I think going to have such a huge impact on our society because they're really things that our generation hasn't gone through before. And so trying to figure out how we can encounter this stress and how we can come out of it a little bit more resilient, a little bit more capable than we are going into it and going into some of these stressful situations. So it's my intention to share the ins and outs with you guys that I have learned personally and through my own practice as well as through the research and all of that. We're going to start here today with our bucket analogy, and we have our little example here. So if we can think of ourselves as this bucket. As we are full, we feel safe and capable, full of energy, and you really can go forward with lots in the tank. You can drive that car for distances and with no problem, not thinking much of it. And now, as this bucket really starts to deplete, we feel like we have nothing left in the tank, nothing left to give. Anything that is added to the situation in terms of stress at that time can be really, really challenging. Maybe it ends up being overwhelming and we're outside of our window of tolerance, that is sort of our safety capable feeling zone, as being overwhelmed. Or maybe we totally shut down and we get into this hypo state, which is under our window of tolerance of just totally shutting down and going numb. And we want to try and as much as we can get within that window and stay within that window and then make that window bigger. And that's what all of these practices really have been about. I think we can all agree, I certainly can, and I imagine the majority of you guys can as well, that we have experienced these kinds of things and that we have been able to understand or really even relate to that analogy of just feeling exhausted and depleted and not having as much filling our bucket as usual. So as we can take those little steps to fill all of those up, then we'll have a little bit more in the tank to go forward with. So what are these things that fill our buckets? Last week we touched on some of the environmental aspects, and we noted how the research really demonstrates that doing all of these different things help to improve our mood, feeling productive, accomplished, capable, confident, and really help us to focus on positive thoughts. And what happens when we do those things is that we then are able to further go forward and decrease our stress or further be a little bit more resilient. And so that was our one aspect of looking at the environment. So go ahead and have a look at that video if you want to check it out. The other two are our inside, more of our mental resilience, how our brain is functioning and how we can retrain that. That'll be next week. And today we're going to go through the outside, inside, and all around. So our outside is really our physical body, and I'm going to talk a little bit about the physical impacts of stress and how we hold on to it, hopefully give you a little of some other encouragement of things that you can actually add on into your regime to change some of those things that we carry. So again, we're going to increase mood, productivity, when we feel more accomplished, when we feel more capable and feel more confident and then have positive thoughts, our bucket in turn is filled up. And then again, this is a feedback loop where we try to encourage more of these positive things, and yet in return, we get more of them and just feel even more and more capable. So the physical side, from the American Psychological Association, I have a little quote that just said, "The link between mood and exercise is incredibly strong. And usually, even after only 5 minutes of moderate exercise, you can get enhancement of mood effects." That's awesome. 5 minutes. Everyone can do 5 minutes. Active people really are less depressed than inactive people. Physical activity can release and decrease all of the different types of hormones and biochemical aspects in the body, such that the result ends up really improving anxiety and decreasing depression. It can also then help improve that idea of when we're in burnout and feeling all of these intense emotions, that we can decrease that aspect of it and then again prevent relapse or encourage this resilience that we're trying to build. There's a whole section on that article that talks about how exercise buffers the brain. And essentially this activity, again, as I mentioned, it really helps to create the resilience to stress. As with really each of the things that we're going to go over, they're easy to do. It's not necessarily always easily done, but the tasks themselves are fairly easy. And it's that perseverance and that persistence of going forward and doing them every day that's going to make a really big difference. And I know personally, even I've dismissed some of these things as to the importance of them. And when you really incorporate them into your life, after a little while, if you let them fall away again, you'll then start to notice a difference. That difference sometimes can be subtle within a day or two, but give yourself a week and there'll be a big difference from day 1 to day 2. So if you're journaling, that's a good way of seeing that difference, and I'll touch on that in a little bit too. If you guys have been following the posts and the other recordings, I've been making my bed every day and it's been fantastic. So I encourage you guys to do some of those things too. That was in our environmental side of our bucket. When we experience something really intense or difficult, and we might even say that when it's an extreme case, it's more of a traumatic event or might be defined as a trauma. As I mentioned, our sympathetic nervous system and our endocrine systems, they all change that physiological environment to an extreme degree. Our heart rate increases, circulation increases, our cortisol level, which are those stress hormones, skyrocket and circulate around the body, and these all have other effects that help us to go into more of this survival and protective mode. And as we re-experience certain events, these can become even more intense with each exposure and every thought. The research shows that brain scans and all these physiological measures that occur with trauma are exactly the same as when we recreate this trauma in our mind. And as we're reaching burnout, people have less capacity to really give in that situation or to feel capable and safe. And that can add as well to the whole experience that we're having. So as much as we can bring down or change the mental aspect of it, so the memories of them, and then our physiological reactions, then we can start to change some of the outcomes and our quality of life really overall. As humans are absolutely unbelievable, and this is kind of why I do what I do, is I have just such a deep fascination with this ability for us to be resilient and this vital force that protects us. So our physical and mental emotional reactions to experiences are always in our best interest. They really truly will always do the best thing for us, even if we don't fully understand it. So for an example, have you ever felt numb or detached from an experience? Sometimes this comes along with a really intense, fearful situation that also has a physical component to it, such as a car accident. The ability for us to detach in this situation, that detach the body experiences from that mental emotional experience, is a beautiful protective mechanism. It really does save us. It's important that when we consider all of the difficult times, maybe even trauma if we've experienced it, or even physical pain, that we don't discredit or downplay its value or what our body is trying to do. We end up then really almost fighting with ourselves of, you're trying to do this, I don't want that. Really, if we can sort of accept it in a way that we're accepting our bodies are attempting to do something helpful for us, and even our mental reactions are attempting to do something helpful for us. And again, we really might not understand it, or we might not understand in the moment of how it is helpful, but I assure you it is trying to do the best that it can in order to protect you. So what are your reactions to burnout or feeling stressed? And when you experience something stressful, can you see how a physical or this brain reaction might actually be an attempt to protect you? A classic example that we often use, or that's often used in the research, is this fight or flight example where a zebra is running away from a tiger or a lion. We have an increased heart rate, a cortisol gets jacked up, and they're going and running away. This is a sprint for survival. And after that whole episode is done, their cortisol levels, everything just returns to normal. Partially because we have that physical engagement. That physical running of the zebra is really important to stir up all of the different biochemicals and the hormones in the body, and to really help release those excess things that are happening, and to allow the circulation of that increase of heart rate to be useful in that moment. How many of us do that in our stressful lives? I wouldn't say that that's my typical reaction to stress, particularly if you're at work or in an office. You're not going to go run around the block 10 times in order to release some of these hormones from a stressful situation. And really, as we go through these little minute stressful situations and they start to increase over time, we carry that with us as well. And so then our stress ends up being longer term. Our brains also process information very differently in these extreme experiences, and we actually then have a disjointed memory of a physical sensation or what is happening at the time, or what we might actually even incorporate and carry into our body, separate from that cognitive experience, which is sort of our knowing and learning and understanding. And that detachment is both then carried forward with us. And sometimes we can start to carry these emotions and these feelings in our body when they're not associated to that cognitive aspect anymore. And that's how we start to tap into it with some of our mindfulness activities as well, is that we want to try and not necessarily create that attachment again. We don't need to do that in order to release that trauma and the stress that's actually carried in your body. Have you ever felt extremely frustrated or irritated, angry, maybe completely helpless, and push some of those emotions aside to get on with your day? After this, did you feel in your body any calmness, or did you perhaps feel tension? We often push these feelings aside as they might come up in these minute stressful events, or maybe even a big stressful event, really to get on with your day and to get on with our different responsibilities that you might have, in order to just feel more okay. We kind of put our head down to the ground, and you just keep going. And many people, in some cases, that really can be resilience in the moment and in the time, but over time we want that to be able to be released so that we can take more on. Because as we get into that mode, you put our head down and we keep on going, that is going to be more and more difficult to come back to, or to add something else to it. So as much as that is helpful in the moment and helpful to really persevere and continue on through, it's not helpful in the longer term to really be resilient to stress, or even a way of overcoming stress. And we want to, as much as we can, overcome stress, come back to our baseline, expand our window of tolerance, and then persevere even better with going forward with a huge bucket that is full, that we can go forward with feeling fantastic. For the mindfulness activities that we've done, these really allow us to tune into the body so that we can understand exactly where we're at, and then going forward, helping to release them a little bit, helping to make us more resilient again for the future. When people go through some of those experiences, as I mentioned, I often hear people reporting that they have tension in their body, and often they can place it. And that's where some of those aspects of tuning into your body, noting where that sensation is, size is it, what color is it, what does it look like, those can be really helpful for helping to identify and just releasing the body tension, just that body tension. We're leaving the brain out of it for that moment. Sometimes people might report that they have a heightened sense of irritability that day, or awareness, maybe even just a little bit more edgy. And again, without releasing these tensions, they do tend to stick around, and then they can develop. And this development and building up is what we want to try and avoid. I have seen these create physical pain, physical tension in the body, in the muscles, in the nerves. I challenge you that just to answer this question, if you have ever experienced stress, and as I mentioned and demonstrated, that pushed these sensations or uncomfortable emotions aside, then again, I dare to say that we all are carrying this kind of tension in our body, and then again, it can be released. And I haven't met anyone who isn't in this situation, so if you're not, please reach out and let me know. I would love to go over more things as to how you become invincible on that way. The more stress and the more trauma, even these minute things that we have every day that add to our situation, the more frequent, the more intense these physical tensions and sensations can be. And this is when our tensions start to build up. Really, they can be every day. And we might interpret this after a while of building up as anxiety or depression, even as physical pain. And it can start to manifest as physical tension in our muscles. Then our nerves and our joints can start to get involved, sometimes headaches and migraines. It can even decrease our immune system. And that's just sort of touching on a few little ideas that I've gathered along the way. There's a huge long list. There's a large portion, I would say, of my patient database that consists of people who are told their symptoms are psychosomatic, which demonstrates or means that they're holding it in their body and that there is not really any other physiological component that is adding to that, and that is sort of coming from their mental emotional side, or their mental emotional is creating some of these sensations in their body. Or I've had many patients who say that treatment just really isn't helping, and so they seek out alternative healthcare and then find themselves in my office. Or that they've been through the ringer, seen many practitioners, and all of their tests are normal. And there seems to be nothing that is causing this severe pain or something that they're experiencing. And so I challenge you to note, is there an emotion or is there a sensation that's attached to these kinds of things and these kinds of symptoms? And are there maybe some little bits of stress load or trauma load that you've experienced in your life that are starting to accumulate and that might be contributing to your ability to deal with a current situation or even deal with that stress or that pain that is currently there? And now, knowing all of this, knowing if we understand that idea that traumas and stresses can be added over time and even on an everyday basis, how do we then improve our quality of life and improve our ability to go forward with burnout and getting out of burnout and then being more resilient? One is to help unwind the physical tensions that are present in the body, and two, we stop adding more tensions. The unwinding one, we're going to go over a couple of those physical techniques today. In office, to explore mostly the latter, when we stop adding more tension to it, but also to release some of these physical tensions, might include things like Psych-K or tension releasing exercises or hypnosis, acupuncture, even the emotional freedom technique, which we explored in one of the other previous videos. You guys can check that out. And then occasionally even injections for joint or nerve health, and that can help to really calm down the nervous system and help to reset it. Some of those can be performed via distance and virtual consults, and obviously the injections cannot be. But there are some physical therapies and some other things out there if you're finding it hard to do some of these on your own. Some of these things that you can do on your own, however, and we're going to again explore that physical side, is just movement. Really getting a lot of physical movement in there, and I have a couple tips or some things that you can keep in mind when you're doing your movement as well. If you thought you knew why exercise is important, I hope that I've painted a little bit of a different picture of the type of stress and how it can be held in your body, and why some of this movement and getting things shifting in a different way can be even more beneficial, especially for your mental and emotional health. So what kind of exercise is going to be the most beneficial? I'm going to leave the specifics up to you, but I will give you some seriously amazing hints that I incorporate all the time. As noted by the American Psychological Association, even just 5 minutes a day can have an impact on your mental emotional health and this ability to be a little bit more resilient. I definitely encourage you to set your sights a little higher, aim for a goal of at least 20 minutes. There's something about really taking that time and sitting with that exercise or being with that exercise that gives us a bit of a mental break, and I think that aspect of it is really important. If you do feel totally exhausted from exercise, please stay within your range or talk to your healthcare providers as well. Sometimes this can be incorporated along with severe chronic stress and even adrenal fatigue or feeling really exhausted and burnt out. And when you feel much more depleted after your exercises, they're not going to be as helpful for you. So make sure that if you are doing whatever you're doing, you're feeling a little more rejuvenated, even if it's a walk and that's just a light exercise versus something that's really going to get your heart rate up. Sometimes with chronic conditions, that is much more difficult to do. So here's one of my favorite tips. If you're ever doing something physical and you get a fatigued muscle where it just starts to shake or vibrate, that is one of the most brilliant releases. Going back to that example of the zebra fight or flight running away from the tiger, they've done a number of different studies where if they interrupt this action with a tranquilizer per se, where an animal is running away from something that is super scary, it has this shaking reaction, almost like a tremoring or a tension releasing. And that shaking can be really helpful. So again, if you're experiencing this in exercise, hold that shake as long as possible. We often try to move our joints and shake it off as best that we can. I experience this a lot when rock climbing, especially if I'm at a move where it's a little bit stressful or might be a bit scary. My foot's on a hold somewhere, my leg will often start to shake, and I'll try and hold that as long as I can without falling off or without needing to make my next move if I'm in a bit of a position that I can do that. So if you ever get that sensation that your muscles are just starting to shake, I really encourage you to do that. As we release some of these physical tensions that we might be holding on to, sometimes you can get a bit more of a mental or emotional release. And so if you find that you're ever more emotional after something like this, or stressful, or really feel like you need to start processing something emotional, please reach out and find that additional support. Could be a counselor or a naturopathic doctor or a yoga teacher, whoever it is that you're finding may actually be trained in that kind of thing to be able to help you through, and who you feel obviously is approachable and helpful for you. The next one really is just to find a workout that you love. People ask me often if I've been doing anything during this COVID time to stay physically active and or workouts, I guess, at home, being that the gyms and such are closed. And my response is always, I really don't like working out. I play. So this is why I rock climb. This is why I walk in the forest or hike or do whatever I'm going to do, because I don't like working out. I like playing. So for a workout, if you're trying to do something at home, my fantastic, amazing friend Jackie from East Peaks Climbing Gym demonstrated this on Instagram a couple of weeks ago or last week, and I thought it was brilliant. It's called a deck workout. So what I do, and I sometimes do this with my nieces, you can do it over FaceTime with people, is that you pick a different activity for each of the different suits. So for hearts, you would have one activity, for spades, you would have another, for diamonds, another, and then for clubs, another. And as you pick the card up, so say clubs was push-ups, then you do 3 push-ups. And say hearts are V sit-ups, where you're fully stretched out and then go and touch your toes. Then you would do 9 of them. And you just go through it, flipping over a card, doing all of the different activities. And I find it way more entertaining, and it keeps my attention for a little while, and is so much fun to do with my nieces. We picked different activities. One of them was jumping on the couch the other day, or one of them was running outside the house and then back again. When we picked a joker, we got to do a little fun activity. So you can check that one out or give it a try. I'd love to hear your experience with that too. I expect that this next one, possibly fewer people will engage in, but maybe one of the most impactful if you get the chance to do it. Find a space all by yourself where you won't be interrupted, and it's going to be a bit of a expressive, interpretive sort of thing, essentially like an interpretive dance. So all we want to do is just feel how your body wants to move and do that. A bit more of an expression. You can turn on music and just have it be a full-on interpretive dance kind of thing. I really encourage you to do it alone so that it's something that you just are doing for yourself, and there's no embarrassment or whatever other emotions might come from that. You don't feel judged or anything like that. Just a space where you can be really fully vulnerable. Even maybe in your car might be a spot, but you're just going to be limited with some of your movement there. And I encourage you to do whatever it is that movement feels like it needs to do in your body to move out. You might be twisting, you might be really big, you might be on the floor, maybe rocking in the corner, whatever it is that you feel your body needs to do at that time. 15 minutes of that a day can be amazing. There's other physiotherapists I know who can work in this kind of manner, and it's called unwinding. Essentially, they support the body, and you might push and pull and kind of start to move the body, and this can release a lot of these tensions that we start to build up over time. So the main takeaway from all of this is really to move in whatever capacity that you can. An intense workout might be really helpful, and you're going to feel quite different from that versus something that's a little bit more gentle, like a walk. And then because of these and how it might help to release the body, or how it might change things, I encourage you to do a journaling activity afterwards. And some of the questions that you might ask really are overall, how did you feel before that workout? How did you feel after? Maybe just jot down the time and the activity that you did. Maybe consider sensations in your body as to what they felt like before and after. How do you feel physically? What are those body sensations? Exploring the intensity of them, the size, quality, texture, color, shape, and then how capable you feel in the world right at that moment. Maybe even before and after the exercise. And are there any messages that your body might want to be telling you at that time? Are you feeling really good? Is there emotion attached to it? Maybe that sensation that you have in there, you realize, like, I actually think I felt angry, but now I feel better. Just jotting down a couple of the things that help you to explore exactly what it is that this exercise is doing for you. Because if you can identify how much of a difference that makes for you, and then even from 1 week, doing it every day for 5 minutes or 15 minutes, whatever it is that you feel you can, and then even checking in the next week of checking in what your baseline was, and then checking in what those exercises are doing for you. And I imagine that they change. Some days I find that the exercises need to be a walk in the park, a walk in the forest, and then other days I really, really find that I need that movement. So just check in with yourself, check in with your gauges, and see where your body is at and what you might need that day. And I encourage you as best that you can to really be consistent. It's every drop, every day that we're using that's going to fill our bucket that will make us most resilient to stress, to burnout now and for the future. I thank you guys so much for joining me on your vacation day today, if you have a vacation, as we do in Canada here. And I hope to see you guys next week. Join me for the rest of the filling up of the bucket. We're going to explore all of the key aspects of the internal aspects that will help to build your mental fortress. Thanks for joining.